Segment on Eyewitness News is sponsored by Living Well.
And welcome to today's edition of Ask the Expert. I am Shay Paul, and I am being joined by Dr. Jared Chapman and guest of Living Well. How are both of you doing today?
Doing great.
Yeah, Heather, the last time we saw you, you had some work done to the lower half of your face. And we've been following your journey for several weeks, actually. I think we started with Botox. There was a little filler, Voluma, correct me if I'm wrong, Voluma in the cheek area. You look fantastic, but today is the day we've been waiting for. We wanted to see the final result. And let's start off by asking you, how do you feel, Heather?
I love it. When Dr. Chapman asked me to do this, my only request is that I didn't want to look done. And I don't look done. I just look fresh.
You look fresh. Yeah, absolutely.
Results.
Yeah, we were talking earlier, and, I was saying to Heather that had I not been privy, to the procedures that she's had done over the last few weeks, I would just look at her and think, wow, what has she been doing? Is her hair different? Is she wearing a new makeup? Because she just looks refreshed. I know you're really big on authenticity. We talk about that a lot. And she looks authentic. She does not look like she's had anything done, but she looks, honestly, 8 to 10 years younger, I would think. That's just my opinion.
Our goal is about 5 to 7 years.
Yeah.
So if you're saying 8 to 10, then we've exceeded our goal.
There you go.
The great thing, the thing we do here at Living Well, and what I try to really pass on to my patients is focusing on the positive and enhancing the positive. And so when Heather came in and we did the initial consult way back, it was about 6 weeks ago, 4 to 6 weeks ago. We focused on what were the positive things she liked about her facial structure.
Right.
And then from that, we built the entire course of treatment around the positive aspects of the facial features. And in doing so, you're able to pull out all the positive, and then it diminishes the negative. And so it may not ever take away all what we call the negative, the aging parts. We may not ever get rid of every line and wrinkle on the face. But what we're really doing is bringing back that life and that refreshness to the positive features of our face. So, this has been great for us to see as well as the practitioner and the staff. We see patients come in, we treat them, they leave. Most of them do come back and follow up, but to see that 6-week journey when you actually see things really come together, because it takes about, once you've had filler and Botox, you need to give the face about 4 weeks to truly assimilate with the tissue, let the products assimilate with the tissue, let everything smooth out. And then, today we're seeing just an amazing result of just a refreshed, a rejuvenated look that, comes from maintaining the authenticity and positivity of the patient's face.
And it's great too, because every procedure that you've performed on Heather on camera here, I've asked her, what is the pain level on a scale from 1 to 10? Each and every time it's been very low. The downtime is very minimal. And as you were saying to me earlier, really very little was used as far as the product is concerned.
Right.
So
if you add up all the different treatments that we did and combine all the filler together, and I know the audience saw us use several different fillers over the course of the 4 to 6 weeks, it was about a teaspoon. So if you put all of that filler into a teaspoon, it would fill the teaspoon level. So strategically placing filler in the face, knowing where to use it to get the maximum lift and the maximum correction is key in using filler to make someone look authentic. Because, yes, you can just shove tons of filler into the face, then that person looks overfilled and done. And those are the things that people see that kind of turn them away from doing a procedure like this. But, again, we also showed things don't have to all be done at one time. We broke the face down into areas that we treated methodically over the last 4 to 6 weeks. And, especially if someone doesn't want a bunch of people to know they've necessarily had something done, that's definitely the way to do it, because it's very gradual over time, the change, and the eye doesn't notice that much of a difference immediately. So I think the most downtime she had with anything we did was her lips. They swelled a little bit, and she got a little bit of bruising, which is normal. We tell all our patients, your lips are most likely going to bruise a little, and you're going to have swelling for about 48 to 70 in the lip area. I don't think it was painful. It was just a little bit unsightly from the bruising. But other than that, that was all she experienced.
Well worth it, Heather. Well worth it. Thank you both for sharing your journey with us.